To all, myself Reena Thakur, Dr. Reena Thakur from Medical Surgical Nursing Department. Today we will deal with the oncology nursing in medical surgical nursing subject. As we all know, what is oncology nursing? Oncology nursing is the field of nursing where we will study regarding cancer. As oncology is the study of cancer. Cancer is a disease in which cells reproduce uncontrollably and they form lumps. These lumps are called tumors that may grow and spread to the other parts of the body. These lumps are also called tumors. Oncology comes from the Greek word that means onkos, meaning tumor, and logos means study. Oncologists are a doctor that treat the cancer, and oncology nurse is a nurse who will deal or who care for a cancer patient. As what is oncology? Oncology is a branch of medicine which is concerned with the prevention, diagnosis, treatment and study of cancer. And a medical professional who practice in oncology is called an oncologist. Oncologist, in clinical oncology, there are three primary branches. Medical oncology, that will be dealing with the chemotherapy. Surgical oncology, the surgeries including the cancer surgeries or surgeries which are required to remove the tumors. And the radiation oncology, in that the physician or the nurses will deal with the radiation therapy. In medical oncology, the treatment of cancer with the medicine including chemotherapy. In surgical oncology, the surgical aspect of cancer including biopsy and surgical resection of tumor. Radiation oncology is the treatment of cancer with therapeutic radiation. Next, we will see the structure and characteristics of the normal cell and cancer cells. As we know, the cancer cells are very different from the normal cell. Normal cells are having well regulate growth. The normal cell only divide into either or develop normal tissue or replace the lost or damaged tissue. Normal cells will be growing only when our body needs either any damage, injury to heal the wounds, only necessary conditions the normal cell will grow, and they have limitations. Normal cells have designed appearance. Each type of normal cell has a client and recognizable appearance. As we know, the structure of muscular cells is different, structure of eye cells which are found in eyes, those are having different, according to their function they are appear and they will function. They have specific differentiate function. Each of our body cell is having at least one special function. Thus cardiac cells having function to contract and relaxation. As our skin cells are there, their cells are very sensitive, they are protecting our body. The kidney cells are different, the musculoskeletal systems cells are different. In our body, every cell is having a specific function, so that these cells are called differentiated. Then joined tight together. Normal cells always bind closely together because they secrete surface protein, and because of that surface protein these cells will be joined together. They never invade into the other tissues and they will grow together only on the same place. They do not migrate, as because normal cells are bound together with the secret surface protein, they do not migrate from one tissue to another tissue. That's why every organ is separated from the other organ, or every tissue is separate from the other tissue. Then show contact inhibitors. Cells division only occur if requires. As we know, normal cells are always respect the boundaries. They know what are their boundaries and they will divide only when there is a need. Or as we know that if the person is injured, there will be a gap between skin or maybe in the muscle. So cells will grow only to fill that gap, and when that gap is filled, after that the cell division will be stopped. So they will always show contact inhibitors, and they never grow into the boundary of other tissues. They will grow only in their boundaries. These are normal characteristics or the characteristics of the normal cells. As we revise, they have well regulated growth, they have designed appearance, they have specific and differentiate function, they join together tightly, they do not migrate into the other cells, other tissues boundary, they always show contact inhibitors. Now let's see the characteristics of the cancer cells. As just opposite to the normal cells, the characteristics of benign cells are different, because some abnormal cells are considered benign even though they can form a tumor. As we know, the tumor cells are of two types, that is benign cells and the malignant cells. There is also a difference between the benign and malignant. Benign cell or benign tumors are less harmful than the malignant tumor. So first we will see the characteristics of the benign cells, as they have inappropriate cell growth. Benign cells are also having inappropriate cell growth. They are growing fastly than the normal cell but lesser than the malignant cells. They show small nucleus to the cytoplasm ratio. In cytoplasm ratio, their nucleus will be smaller. They have designated appearance. Their appearance is not that much bizarre than to the malignant. They have specific differentiate function. They look like functioning cells, and they will having the specific differentiate function also. They do not migrate. Benign cells always grow in their boundaries. They will just grow at the same place. They never migrate to the another organs. They will grow continuously into the same place. So these are the characteristics of the benign cell. Next are the characteristics of malignant cells. A malignant tumor, as we know, the malignant cells or malignant tumor is more harmful than the benign tumor. A malignant tumor composed of cell that invade the basement membrane and invade or spread one part to the another part of the body. As malignant tumor cells, they are composed of cells which can invade or which can enter into the basement membrane, and they can go from one part of the body to the another part. Like if the cells are growing in kidney, they can also go into the cardiac cell, or they can go into the brain also, and they will divide there. So that is called migration or metastasis. They have continuous cell division and poorly controlled growth. As compared to the benign cell, malignant cell are more they are having poor control over growth, and continuously they will divide. And even that cell division, as we know, in normal cells, with the cell division, either cell will form two cells or four daughter cells in sexual cells. So in malignant cell, there is no any specific number of daughter cells. They can divide and they can produce two daughter cells, 4, 6, 8. Any numbering of any number can be there of cell divisions, daughter cells. And they also poorly control their cell growth. The cell growth is not controllable. They will continuously growing. They do migrate or metastatic join together. Because these malignant cells are very poorly joined together, they can easily detach from one place, or they can easily migrate to the other places by the methods. Certain methods are there by that continuously growing, by involving or attaching into the blood vessels. They can introduce into blood vessels, and by the blood vessels, by the lymphatic system, they can easily migrate from one organ to another organ. And that process of migrating from one organ to another, one part of the body to another part, is called metastasis. In malignant cells, the malignant cells has no useful functions. They are always harmful to the body. As we know, the malignant cell, they will not perform any function. They just increase in numbers only. So these are the characteristics of malignant cells. They can invade into the basement membrane. They can invade or spread one part of the body to another part. They have continuous cell division. They are having poorly control over growth. They will migrate, and these cells having no useful function, they always harmful to the body. So these are the characteristics of normal cells and the malignant cell. Now we will see the nursing assessment, that is history and physical assessment in cancer. There will be a careful and effective assessment of patient present and past surgical history should be obtained. In that, a complete physical examination, both objective and subjective data should be completed. In that, during physical examination, and we will find some symptoms like anorexia, weight loss, anemia, fatigue, metabolic alterations are there, pain will be assessed. And assessment of pain is not early sign of cancer, but it can occur as a result of obstruction and destruction, because malignant cells or cancer cells will continuously growing and they will compress the surrounding tissues or structures, and because of that the obstruction and compression causes the pain. By assessment, we will assess the health team to build a plan of cure relevant to the patient's needs, monitor laboratory WBC count, RBC red blood cell count, monitor patient's weight, and note the complaint of nausea, patient's changes in taste, vomiting, diarrhea. Will also monitor the dehydration signs. These are some signs that we have to see during the assessment process. Then important psychological issues related to cancer are as very as the person affected with the disease. They help the patient and explore the perception about the quality of life. Culture and age will affect the cancer perception, determine what information the patient has received, and understand about his or her disease prognosis, assess the role of patient and care given in the family. So these are some important aspects of assessment of a cancer patient. Now we will see the prevention, screening, early detection and warning signs of cancer. As cancer prevention is a very vast part, in that cancer prevention means it is an action taken to lower the changes of getting cancer by preventing cancer. Number of new cases of cancer in a group or population is lower. At least third of all the cancer cases are preventable. Then it included tobacco is the largest preventable cause of cancer in the world that can be prevented. In cause 80 to 90% of all the lung cancer deaths and about 30% of all the cancer deaths in the world can be preventable. Dietary modification is another important approach to the cancer control. Now we'll see cancer safeguards, or some points or some practices that we can include to prevent from cancer. For lungs, do not smoking. For colorectal cancer, have proctoscope examination as a part of regular checkup after age 40. In breast cancer, practice monthly the breast self-examination. For uterus, have a pap test as a part of regular checkup. To avoid skin cancer, avoid overexposure to sun. For preventing oral cancer, have a regular mouth examination by dentist, and complete body checkup. Have an overall physically checkup 3 years intervals. These are some points by that we can prevent cancer. Now we will see the warning signs of cancer. These are very important signs of cancer. These will help us to detect cancer early. These are also known as caution. That is the short form and caution will include C for changes in bowel and bladder activity, as in any changes in bowel or bladder activity, that will be a early sign for a cancer. A for any sore that does not heal. If we are having any sore in our body, after treatment also if it will not be healing, then it can be cancerous. U, that will be for unusual bleeding from any body cavity or any body orifices, like rectal bleeding, oral bleeding, yeah, either GI bleeding or bleeding from the nose. If there any unusual bleeding, that can be a sign for cancer. T, including thickening of any lump. If we are having any lump in our body which will be continuously thickened and increases in size, so that can be a sign for cancer. Then I is for indigestion. If the person is having indigestion for a longer time and he will not be treated properly, then it can be a sign for cancer. O is for obvious changes in wart or mole. If in our body we are having mole or any wart, and any time of life, if it make changes, or if you see the changes in wart or mole, any color change, size change, any obvious changes, then it can be an early sign for cancer. Then N for nagging cough or hoarseness. If the person is having cough, or continuously voice changing will be there, or continuously cough will be, and that will not be treated after treatment also, after taking treatment also, then it can be a warning sign or early sign of cancer. So that is the caution. These are warning signs which we have to assess all the time in our body, and if we feel any change or any sign that we will observe in our body, then we have to consult the physician. Now screening and early detection of cancer. As screening means looking for early signs, particular for any particular disease in healthy people who do not have any symptoms. That is called screening. In screening for cancer, it will aim to find out the cancer as early as possible when the chances of cure is highest. So cancer screening aim to prevent cancer are detective as early as possible. Early detection refers to an attempt to diagnose the cancer and is a curable stage where cancer screening is just one of the strategy used to achieve his goal. In screening for cancer, it involves the use of examination and physical tests to search and identify the disease in a symptomatic person. According to American Cancer Society guidelines for early detection of cancer, the screening tests are used to find out the cancer before a person has any symptoms. Here, the American Cancer Society recommended a health guide when you talk to your doctor about screening for certain cancers. So first is for breast cancer. Women who are having age of 40 to 44 years should have a choice to start annual breast cancer screening with mammograms if they wish to do. Women who are having age of 45 to 54, they should get mammograms every year. Women 55 and older should switch to mammograms every 2 years, or they can continue yearly screening. Screening should continue as long as woman is in good health and is expected to live 10 more years or longer. Then all women should be familiar with the known benefits, limitations and potential harms which are linked to the breast cancer screening. Women should also know how their breasts normally look and feel and report any breast changes a healthcare provider right away. Next is colon and rectal cancer and polyps. For people at average risk for colorectal cancer, American Cancer Society will recommend starting regular screening at the age of 45, and it can be done either with a sensitive test that look for sign of cancer in person's stool, that is called a stool based test, or with an examination that look a colon and a rectum, that is visual examination by the proctoscope. Talk to your healthcare provider about which the test might be good options for you, and to your insurance provider about your coverage. And no matter which test you choose, the most important thing is to get the screened. If you are in good health, then you should continue regular screening through the age of 75. For people ages 76 or to 85 years of age, they should talk to their healthcare provider about whether continue to get screened is right for you, and when deciding, take into account for you your own preferences and overall health and past screening history also. Then people over the age of 85 should no longer get colorectal cancer screening. And if you choose the screened with a test other than colonoscopy, then any abnormal test result need to be followed up by the cancer screening up with a colonoscopy. So this is the part 1 of oncology nursing. The next or other screening or preventive part we will deal in the next part of that video. Thank you.